I have seen on the Keys website, I've seen a lot about balanced care method. Can you talk me through it?
So, the balanced care method is the cornerstone to the Keys approach to care. It really is why so many people choose the Key as their care provider. It's why a lot of physicians and other trusted advisors to older adults refer to the Key, because it allows us to go beyond the basics and provide another level of care. So, the balanced care method comes from research around longevity, health span, what is within our control. So, modifiable risk factors. What can I do in my control to help me live a life where I'm cognitively, physically, emotionally healthier? And so, the balanced care method has 6 pillars. Move more. So, this is all about exercise, safe movement, movement to the extent that your body can move, connecting with others. So, socialization, recognizing how important loneliness can be to address in terms of someone's health. So, that connection piece. Flex your mind. So, making sure that there are opportunities for cognitive stimulation built in throughout the day. If people are bored, if they're understimulated, that's not great, both emotionally but also cognitively. It'll start to have an effect after a while. Nourish and hydrate. So, obviously, making sure that people are paying attention to eating foods that are whole foods, clean foods, that they're hydrating. Not being hydrated is actually a huge risk factor for UTIs. People can suddenly look very confused in older adults. And so that's a critical piece of health. Sleep well is our next pillar. So making sure that people are getting adequate sleep. The care plans can be highly specific in this area for our clients. So sometimes it's about limiting naps. Sometimes it's about sleep hygiene, making sure that people aren't having their favorite Nespresso late at night right before bed, or watching content that's really disturbing or overstimulating, helping to build in that kind of calming routine. And then engaging with joy and purpose, which is huge, right? Making sure that people have opportunities to have purposeful engagement. So it's going beyond just handing someone a puzzle and saying, have fun. It's about really getting to know the person and saying, for example, okay, they used to be a teacher. They love to teach. What can I build into the day that helps them flex that skill of teaching? I've seen amazing things happen in the home. So I've seen examples where caregivers might come in and say, I don't know any American sayings. I would love to learn some. Would you teach me some? And it'll be these beautiful conversations where there are these sayings that they're learning and talking about what it means. And have you ever experienced this in your life? And so that's where the real magic of care happens. And I do think a lot of the excellent care that we see comes from looking at the pillars of the balanced care method and saying which ones are most relevant to this person at this time that I can incorporate into their care.